You're watching Education for Health Professional Regulators of Ontario, colleges under the Regulated Health Professions Act. Richard Steinica is a senior partner of Steinica Mikura LeBlanc, and he practices exclusively in the area of professional regulation. Richard is a noted author of the Complete Guide to the Regulated Health Professions Act, which, because of its comprehensive nature, has been cited by courts and tribunals, even in cases dealing with non-health professions. Marshall Molesky is the past president of the Federation of Health Regulatory Colleges of Ontario, and he serves as Chief Executive Officer and Registrar of the Ontario College of Pharmacists. Join Marshall and Richard now as Marshall poses a number of important questions on behalf of those of us who want to know more about regulating healthcare practitioners in Ontario.
Some may question why we even have the topic on the subject of facilitating practitioner competence in an education program designed for council and committee members. Isn't that what this whole presentation is all about?
Yes, it is. But we want to look at it from a slightly different angle. There are two things that are expected of practitioners, that they are professional and they are competent. Professionalism really is knowing what the expectation is and having the desire to do it. Competence is much more difficult to describe. It involves having the knowledge, skill, and judgment and attitude to provide a highly competent service. So how can college facilitate this epitome of a soft skill? How can college council and committee members contribute to this? And I would say that you do this through contributing to the culture of the profession. You want to ensure that you do things that motivate practitioners to want to excel in their practice. You want to ensure that they look at their environment to excel in their practice. And you want to ensure that they have opportunities to excel in their practice. So in this respect, the college is not only scrutinizing the conduct of its members, it also has a coaching role.
Richard, what are some of the things that the college can do to foster a culture of competence in the profession beyond the regulatory activities that we've already discussed?
First of all, the college needs to identify and write down the competencies it is expecting in a particular context. So for registration, you want to have documented entry to practice competencies. For an exam, you want a blueprint. You want to have published standards of practice for various areas that is administered by the various committees of the college. You want to have checklists for assessments. And you want to develop these documents with care. You want to use a valid process, not just a few people sitting around the table, and you want to use consultation whenever appropriate. Then you want to also gather information about challenging areas for practitioners. So what are the recurring issues faced by the registration committee? What are recurring complaints? What are recurring gaps in quality assurance? What are areas in which people are appearing before discipline over and over again? And what are the recurring reasons for incapacity that's triggered by behavior or conduct by a practitioner? Then you would analyze that data, and once you've developed some guidance, you want to apply those standards uniformly across the college, especially for a newer document. So, for example, if you had a new standard on being sensitive in obtaining informed consent from clients and patients, you want to ensure that this new standard is taught at the schools, that it's assessed in the registration process, that it's applied by the ICRC for cautions and remediation directions, that it's assessed by the Quality Assurance Program, and that's part of the patient or client relations program. Then you want to market this new standard. You want to sell it so that people in the profession, the practitioners, are persuaded that the new competence is something that they should have, that it's desirable for them to apply in their practice, that there's something in it for them as well. And you want to send this message through multiple media and from multiple angles. And there are some examples. Some professions have developed a culture of client-centered practice, and the regulatory colleges were a part of that. And a more specific example, in the midwifery profession, the decisions made by the client is very significant. And so instead of using informed consent, they use the concept of informed choice to convey that it is the choice of the mother.
So Richard, you've been talking about the college as facilitating competence. What is the role of the council and committee members?
First of all, council and committee members have to model competence in their own practice. People are watching you, you are very influential, and nothing destroys credibility of the college's message more than if the college's leaders are hypocrites in the area. So look at your advertising. You're complying with the college expectations. In terms of patient or client confidentiality, are you gossiping a little too freely about what's happening with your patients? There's a real-life example where someone was facing discipline, sent an undercover investigator to every professional member of council to see if they were doing the same thing that the member was being disciplined for. And lo and behold, many members of council were doing something similar, and the media was there at the discipline hearing to hear the tape of the undercover operation being played. Public members need to also be consistent in applying this to their day jobs as well. You also want to model competence at the college in terms of the expectations you expect of practitioners in terms of civility, not having a lot of errors, communicating effectively, being responsive to inquiries, and not being misleading or exceeding your scope, and making sure that obvious concerns are addressed. Those are all things that you need to do in council and on committees when you are addressing issues.
Thank you.